it's Mia, your resident registered nurse. I'm here to nerd out about all of the next gen in healthcare tech at CES 2024. I'm here with Dr. Stephen LeBoeuf from Valencell. We're talking about a fingertip blood pressure monitor. So tell us a little bit about Valencell, why this is important, and what led you to create it.
Company vision is to help people live longer, healthier lives, but through validated physiological insights. By validated, what I mean is that it's proven. We've done the work to show that this really works. And our first consumer medical product that we're intending to launch this year, post FDA clearance, is this fingertip blood pressure monitoring device. The whole purpose of this device is to measure your blood pressure simply by placing your finger inside the device and press and go. It's to make blood pressure monitoring a hell of a lot easier and a lot more convenient, so that you do take the measurements and you do get the adherence.
So this is going to be for people who want to have more agency and control of their health at home without having to go into their physician's office and have it monitored by that big bulky.
That's right. There's a bunch of things, Mia, about taking a blood pressure measurement that are aversive. One thing nobody ever does is at home is size the right cuff size. The alignment is oftentimes not done correctly. They don't have their arm at heart level when they take it. Sometimes the feet aren't all on the floor.
Or they're crossed.
Or they're crossed.
Right.
So this solution solves a lot of those issues. There's no alignment to worry about. It works off the arterioles in the finger. So, there's no arterial alignment to worry about. There's also no strap to worry about. There's no compression to worry about. There's no issue with any of the mechanical parts wearing down and causing errors later on because it's all electronic.
So it's more compact, more comfortable, and that should lead to more public health usage and more public health data to keep those people well.
Like you said, it's so small, like I can fit it in my pocket. Just pull it out whenever I need to. So for example, if say my physician has said, look, I really would like you to track multiple times in the day at the office. I'm sure as hell not gonna put a cuff device in my pocket.
Right.
But this I can. And I can bring with me, I can test in the morning, I can test in the office, I can test after I eat. I can test before I go to bed. It really helps achieve the goals of public health that we've been trying to achieve for a long time. I really believe that this solution enables a way to solve the adherence problem for blood pressure monitoring.
Absolutely. So not just for the elderly or people who have hypertension or hypotension, but maybe for chronic illnesses like POTS or postural orthostatic tachycardic syndrome, when you don't know when that blood pressure issue is going to show up. But because it's so compact and it has a long battery life so that you can keep it with you and always make sure.
It has months of battery life.
Months of battery life.
Because that's one thing, with wearables, Valencell, we're mostly known for the heart rate technology we've licensed out to the market. That's in hundreds of millions of devices worldwide now. That particular technology really wasn't directed towards chronic illness. It was really connected towards sports and fitness. But this is something that goes right in line with chronic disease management.
As a nurse who's done home health, one issue that I have run into with at-home blood pressure monitoring is they either are required to be plugged in or they're required to use batteries, and it just so happens the one time I need to use it, the batteries are dead. So
one of the challenges with wearables is that you got to charge them so often, and people quit using them at the point of having to charge. Because you plug it in a charger, you forget about it, and it's annoying. But this device goes months with these, I want to say they're 2 AA batteries. In the big picture, what we imagine is ultimately people will be choosing this as a way to monitor the blood pressure outside of the doctor's office at home. But our go-to-market is really focused on people who want to take charge of their health. They've been diagnosed with pre-hypertension or hypertension. They understand technology. They usually, buy things online. That's our go-to-market because they're the easiest to understand this and they want to pay for it now. Yes. They want to buy it now. But we want to democratize that to be broader, to where everybody can use it. I'd like to kind of go through the demo while Scrimshaw, our CFO, is the one who we're reading from. It's one button to operate. You don't need the app. We will show you the app, but you don't need the app to operate it.
So that makes it even more accessible.
Exactly. The app does help though, because the data, it's 2 things. One is your input data to start the very first measurement uses the app. That way you don't have to enter your age and weight and things like this on the device. But then also, this device, when it's close to the app, it'll send the data right to the phone. So then you can send messages out to your caretaker or physician, whoever you'd like to send those to through the phone. We'll go ahead and Scrimshaw will stick his middle finger in here. Now, you'll note that this is not ideal. His arm is not at heart level here. It'd kind of be better if you put it on your knee. It's a little bit closer. So the first thing I think it's asking if you're Scrimshaw. So are you John? Yeah. So making sure it's him.
And is it always going to be that middle finger?
Yes, the FDA has asked us to pick a finger.
Okay.
And the middle finger was, in our view, the easiest for people to, you see how he's got it propped here with these fingers here?
Mm-hmm.
It makes it more comfortable.
Yes.
So the first thing it's doing right now, you see this little swirly thing here? It's trying to understand, where's the blood flow? Do we have blood flow in this guy, a human being, getting the right kind of blood flow to take a measurement? As soon as it feels good about it, it's gonna stop, and you see it right now. Now it's taking the actual measurement of his blood pressure. We like to get at least 30 seconds of good data, and then we generate a
reading.
measurement. Yeah. So the whole process takes about a minute in order to get a reading. Once this ring fills up, it's going to go ahead and present a systolic over diastolic value on the device. Now, if your phone is in range, it's going to send that automatically to the phone as well. So, for example, if you have a harder time reading that screen, you'll be able to see it in big font on your phone.
Oh, perfect. So what do we got?
So normally it would display the outcome on it, but it sent it right to the phone.
So we have 124 over 79. That looks pretty good.
That's good for CES, man.
How many measurements can we see? Oh, so a lot. And look at how you're right in line.
So a graph.
A graph? Perfect.
For the month.
So this
calendar
really
view.
allows you to check your trends.
Of course, right now it's not available for sale.
Mm-hmm.
It's got to go through the FDA clearance process, which is good. You want those people to be
Absolutely.
making sure it's safe and effective. We plan to launch this year, Q4 this year, under this timeline. So this is the commercial version of the solution. Last year at CES, we demoed units, but we made clear they were prototypes, not commercial ready units. So now that we have the commercial ready units, we can run those through the 510K study. So that starts this month. It goes on for a few months. We got to collect a lot of data, more than you usually would for a blood pressure cuff, because the FDA wants to make sure, since there's machine learning here, that we collect a diversity of people in that study. We're going to submit to the FDA in April. We imagine we'll have some back and forth with them for a while on that submission. And so with that done, we anticipate being able to launch, get our clearance in Q4 of this year.
So have you decided what the price point would be?
Not quite yet.
Okay.
We do know, as for our go-to-market, that the go-to-market group, they're willing to pay a premium. Mm-hmm. And so, to get our product out, it will be a premium price product. But exactly the price point, not 100% certain yet.
Okay. Do you feel like it would be covered by some insurances?
In principle, it should be.
Right.
Because you can use your HSA now to buy blood
Yes.
pressure cuffs. And there would be no reason why you wouldn't be able to do that for this as well.
It does sound like it's going to be an extremely useful device to keep everyone healthy and well as we go into the future. Speaking of the future, though, once it's launched, what do you see in Valencell's future? Any new devices?
I like the way you're thinking. So at Valencell, we see a roadmap on two fronts. One of the things is the hardware was designed here to where it would be very versatile, so we don't have to change the hardware and we can add new functionality into it. For example, the sensor module on here, it's capable of measuring SpO2. It doesn't do that now, but it's capable of doing that. So running that through our roadmap in the longer term. Also, another thing is integrating a digital therapeutic into this. And the way it would work, we're members of the American Heart Association, and the American Heart Association has various different protocols you can use to improve your blood pressure through diet and exercise. So we want to integrate those into our solution. It basically works like this. You get the device, you say you found out from your physician you may be pre-hypertensive or hypertensive, and you probably don't want to take medication for it. You want to fix it yourself. So then for 2 weeks, we just say, be normal, live your life as you normally do, let's see where you're at. Once we have that, introduce a known therapeutic, a general wellness therapeutic, that's known to help reduce blood pressure through diet and or exercise, and see what's working for that person. They can do it straightforwardly through the application, which coaches and guides them, and then also allows them to use the device to track their blood pressure. So that's the big picture is in the digital therapeutic side, and also additional metrics without having to change the hardware. Another thing about this technology is that it's designed based off Valencell's core technology that's in so many wearables today to measure heart rate and to measure breathing rate and all these other parameters for general wellness purposes. Now, this is medical, but we see taking this medical grade technology and eventually transcribing it into wearable devices so that people can also eventually get passive monitoring. When we've done our market analysis, we found that some people who don't want to ever wear anything, they just want a quick spot check, take the measurement and be done with it. And there's other people who would like to wear something passively. So down the line, we'd like to be able to satisfy that need as well.
So you could choose whether you want to just slip it on your finger a couple times a day,
Yes.
or choose whether you wanted to measure your blood pressure a couple times a day without you even having to think about
That's
it.
right, yeah. And it's really different strokes for different folks. Some people just don't want to, like I'm not a person who likes to wear too much. We want to be able to provide chronic disease management solutions for everybody.
Well, thank you so much for your
All
time.
right.
It was wonderful to speak to you. Again, this is Dr. LaBeouf from Valencell. I'm Mia. Stay tuned for more health and wellness tech right here at CES 2024.